Assalamualaikum everyone, welcome back to this channel. So this is me Arya Wahid, and in this video we are going to start the next topic, and this is about the treatment of irritable bowel syndrome. So in the previous lecture we have discussed that what is the irritable bowel syndrome, we have discussed its types, we have discussed what is ulcerative colitis, what is Crohn's disease, and we have seen the difference between them. After that, we have discussed the symptom of this disease. We have discussed how to diagnose it. Then after that, we will discuss that what kind of effects of this disease you have to observe. And at the last, we have seen the pathophysiology of this disease. But now in this lecture, we are going to start the treatment of this irritable bowel syndrome. So this is the part one of this lecture. So Bismillah Rahman Rahim. So in the treatment of irritable bowel syndrome, which can be abbreviated as IBS, okay, irritable bowel syndrome. So what are the goals of your therapy? So you have two goals of therapy in it. The first is the induction of remission, and the second goal of therapy is the prevention of disease flare. Now, what is mean by this remission and what is mean by disease flare? So here the definition of both of these terms is given. The remission is the process in which the symptoms of a disease is in the under control. So it is a process in which you have control over the symptoms. You will never allow the symptoms um, to being mixed or to being very kind of severe. So therefore you are controlling the symptoms of a disease. You are making a person symptomless whether he has a disease or not. So this process is called as a remission. Now what is your goal of therapy? You have to induce it. You have to induce the process of remission. You want that a particular person who have IBDS should be symptomless. Now, what is disease flare? So it's defined as it is the worsening of a disease. Worsening mean the severity of a disease, that the disease which is going to be progressing and going to at its last stage. So the more the worsening of a disease, more it is the disease flare. So we have to prevent this. We don't want that the disease should be progress or become very severe. So we want that our disease should be in our control and should be curable. Now there are two types of treatments which are given to the patient who have IBDS. Two treatments are given below. First treatment is non-pharmacological treatment. In non-pharmacological treatment means that there is no kind of drug involved in this treatment. So in this treatment, we will just say to a patient that you have to take these things and you don't have to take these things. Like here I have written some things which the patient should not take, and here I have written some materials which patient can take. So the patient of IBDS should not smoke, should not consume alcohol, should not eat spicy foods, and should not take non-steroidal anti-inflammatory drugs. So actually these are the drugs which can increase the inflammation in this particular kind of disease. So therefore these drugs can also make this irritable bowel syndrome more severe. So therefore these drugs should not be taken when you have irritable bowel syndrome. Now, what kind of food you have to take in this disease? So, diet which is rich in fibers, which is rich in dietary fibers, you should take them. And mostly, almost all the fruits and the vegetables have high percentage of dietary fibers in them. Next thing, you should take the omega-3 fatty acids. These are the most important and most healthy fatty acids which promotes the health of your heart, which promote the health of your liver. So you should take them. And the omega-3 fatty acid is present in your fish. So the fish is a major source of this omega-3 fatty acid. So the person who have irritable bowel syndrome should go for a fish and eat it and make his life happily. Now, let's discuss what are the pharmacological treatment of disease. So, in this pharmacological treatment, we will go towards the drugs. Now, we will discuss what kind of drugs should be given to a particular patient who have IBS. So, here I have written four types of drugs which should be given. The first is the 5 amino salicylates. second is glucocorticoids, then third is immunomodulators, fourth is TNF alpha inhibitors, and at the last you will do the surgery. So now here I have written that I am going to classify these drugs on the base of drug severity. So कितनी ड्रग डिजीज आपकी स्वेयर है उसकी बेस पे आपने ड्रग को डिवाइड किया है। जैसे अगर आप देखें कि अगर आपका जो 5 amino salicylate, this drug should be given when you have a mild stage of the disease. Then you will give your patient glucocorticoids or immunomodulator when you have moderate disease severity, and at the last you will give TNF alpha inhibitors, or you will do the surgery when we have severe kind of disease severity. So here I have divided these drugs on the base of your drug severity, whether it is mild, whether it is moderate, or it is severe. So now we are going to discuss all of these classification. First of all, in this lecture I am only going to cover this first class, which is the 5 amino salicylates. The next drugs should be covered in the next lecture. So let's discuss it. So now we are going to start our first classification, which is the 5 amino salicylic acid. It can also be abbreviated as 5-ASA. So 5-ASA, how it's formed? 5 amino, A for amino और A for A, and sali से CS निकला है और acid से A निकला है. So it can be abbreviated as 5-ASA, and it can also be called as 5 amino salicylates. Okay. Now, first of all, we are going to see what is the background of this drug. So the first is it has the effects like anti-inflammatory effects. You know very well when we have discussed the pathophysiology of IBS, we have discussed that this disease happens due to you have inflammation in it. So you have discussed that there is the activation in the WBCs, and due to activation of them you will release some types of chemicals, and these chemicals provoke or increase the inflammation, due to which you have this disease. So therefore now the drug effects of this drug is anti-inflammatory, so it is decreasing the inflammation, it is reducing the inflammation in it, and it is used to treat the mild IB. So when you have mild type of drug severity, then you will give your patient this drug and it should be treated out. Now let's discuss the mechanism of action. So here I have written the mechanism of action. So on so let's discuss it. So four kind of mechanism is happening in it. Now I am going to explain every mechanism one by one. So the first mechanism is that it is going to inhibit the prostaglandins. By inhibition of prostaglandin, it is going to decrease the inflammation in your body. How? Here the mechanism is given. So for example, let's consider this is a cell, and this could be a parietal cell, could be a intestinal cell. Okay. Now in on this cell you have a receptor on it. I have drawn here. This receptor is called PGE2 receptor. So these receptors are naturally present on these intestinal and parietal cells, which are present on your stomach. So parietal cells are in your stomach, and intestinal cells of your large intestine or small intestine, they have these receptors. Now, what is happening in these receptors? Your arachidonic acid. This arachidonic acid is produced by some substances. So, this arachidonic acid is on the action of some enzyme, like oxygenases enzyme is present. What? Oxygenases enzyme. This enzymes will present, and it will convert it into the prostaglandin. Now, prostaglandin form, actually the prostaglandin has two types, PGE2 and PGI2. So this PGE2 will cause the inflammation inside your cell, or will make the inflammation. So now we are going to inhibit this prostaglandin. If we inhibit this enzyme, okay, if we give 5 amino salicylic acid, what will happen? This drug will inhibit this enzyme, and when the oxygenases enzyme is inhibited, it means the prostaglandin will not produce, the PGE will not cause the inflammation inside your body. So this is a way to protect your patient. Now, the next mechanism of action is to inhibit the leukotrienes. What are the leukotrienes? They are the lipid modifier, and you can also call that they are the inflammation causing agents. So how they are produced? Actually, your leukocytes, your white blood cells, they are producing these leukotrienes. They are the inflammation causing substances. How they cause the inflammation? For example, let's consider this is the cell, or inside your cell this leukotriene will produce, and after this production it will bind itself to this G protein coupled receptor, and after the binding it will cause the inflammation inside your cell and causing the inflammation. Now, what is going to happen? Simply, you will give 5 amino salicylic acid. This 5 amino salicylic acid will inhibit the binding of leukotrienes on this receptor, and producing no inflammation. Now, let's discuss the third mechanism of action, which is to decrease neutrophil chemotaxis. Chemotaxis means the chemical attraction. So, what will happen? Let's suppose you have an inflammation at a site. Okay, let's suppose, let's consider correctly. I am considering that this site is inflamed. Now, what is happening inside your body? That your body will send some types of cells which are present in your body. These cells are called as neutrophils. They will travel toward this inflamed site and going to react with this site. Okay, so whenever any kind of bacteria enters, these neutrophils go here, and they are actually chemicotaxis. They attract the chemicals. So in this inflamed side, various kind of chemicals are released. Various kind of like these chemicals are released, and these chemicals are sensed by these neutrophils which are present in your blood. They will go toward that inflamed side, and causing your inflammation more severe. They will swallow, cause the swelling of this inflammation like this. First the inflammation is this at this side, then after this reaction it will make the inflammation more severe. So therefore, we should decrease the neutrophils in order to decrease the inflammation. Last is the antioxidant activity. So we should promote the antioxidant activity, because the production of your free radicals can also cause the inflammation to you. So, in order to protect from the inflammation, we will give 5 amino salicylic acid, which is going to increase the antioxidant activity inside your body by decreasing the production of oxygen free radicals. Actually, these free radicals are free, so therefore they will bind with any organs, and after they will cause the degradation of it. So therefore we will decrease their production, and if we should decrease the number of already present free radicals inside your body. So by this way we can inhibit the inflammation in a particular person. So this was all about the 5 amino salicylic acid and its mechanism of action. Now all of these mechanism of action will be repeated after and after. So therefore you should have a complete concept of this mechanism of action inside your brain. Now let's discuss about the classification of 5-SA. Now we are going to classify this amino salicylic acid drug. So this is classified on the base of their formulation. So what is mean by formulation? That they are classified on the base of their structure, and they have some differences in the structure. So therefore they are classified on the base of it. Now let's go on its classification. So now here you have given the 5-SA drug, and it is classified into two groups. This is the classification. First classification is the azo compound, second is mesaamines. So now we are going to discuss this classification. So the first is azo compounds, then after that we will discuss the mesaamines classification. So what are the azo compounds? First of all, I have give the definition of it, that these are the compounds which contain azo bond in them. And what is azo bond? Azo bond is the nitrogen double bond. Means two nitrogen which are bounded by a double bond. This bond is called as azo bonds. So all those compounds which contain this bond, they are called as azo compounds. And what is azo bond? This is the two nitrogen bounded by a double bond. Now, this azo bonds connects 5-ASA to sulfapyramidite and some inert compound, and after this connection the azo compounds or the will form. How they will form, we will discuss it in its structure. So therefore leave this point, this will be explained in this area. Okay, so be patient. Now let's discuss what are the importance of azo structures. So here I have written the 3 points of its importance. The first importance is that due to this complex structure, so it is forming a complex. So this complex structure is decreasing the absorption of 5-ASA in small intestine. So what is its importance? That this structure is very complex, so therefore we don't want this drug to be absorbed inside the small intestine. We have to retain this drug, and we have want that this drug should be moved toward your large intestine, and after moving toward large intestine it should be degraded. So therefore in order to prevent it, we will form the complex structure, so therefore it should be prevented. Then what happens that we will give this drug in the inactive form, and after that it will go to activate. How it is going to activate? In the terminal ileum or colon. This is the last part of small intestine. This is the first part of large intestine. In these parts, in the end of these parts, some bacteria are present. You know very well that. So sorry for it. So you know very well that 90% of bacteria population is present inside your large intestine. So these bacteria release an enzyme which is called as azoreductase. By this enzyme cleaves the azo bond and allow 5-ASA to perform its action. Okay, now let's see on its structure. So this is 5-ASA. Okay, and this is the sulfapyramidite. Okay, these two molecules are present, and they join themselves with azo bond. So when the azo bonds form between them, a drugs form which is sulfahalazine. Actually, you will discuss sulfahalazine as a classification of azo compounds. Okay, so then the sulfahalazine is formed. Now, this sulfa-alazine, due to this complex structure, it will move safely through the small intestine. It has very low absorption in it. When it reaches the terminal or ileum colon, due to presence of bacteria, autoreductase enzyme will cleave this bond. Okay, and after this, they will separate out. Now, I am removing this bond. Now they are separating out, and now this compound is actually responsible for the anti-inflammatory action. This compound has no importance as an anti-inflammatory, so therefore, but it has some kind of adverse effect. Okay, we will discuss it when we discuss the whole drug of it. So now let's discuss the classification of azo compounds. Classify into three groups: sulfasalazine, balasalazine, olasalazine. So salazine word is repeated in all of them. Okay, as you can see here. So how to remember it is Salfa or Bala. You know the drama of Sultan Suleiman and the Bala. So these are the husband's wives. So now you are going to change the name of Bala's husband. Now the Swan is not the husband of Bala. Salfa is the husband of Bala. So Salfa or Bala. You will remember it. So azo compounds are what? Sulfa or Bala. Now let's discuss the first drug, which is the sulfasalazine. Now, the other two drugs will not be discussed in that lecture. They are not very necessary. So, sulfasalazine, what is the background? Anti-inflammatory effect, which is related to salicylic group because its structure contains the structure of salicylic acid. What is used for? Used for the treatment of ulcerative colitis and Crohn's disease. What type of form these drugs have? So they are the actually product. What are the products? These drugs are inactivated form. They should have to convert or activate themselves. How they activate? Bacteria present, in the terminal ileum colon. The autoreductase enzyme of this bacteria will cleave the azo bond, and after that it will convert into the activated form. A for activated. So now let's discuss the structure of these drugs. So what are the structure in these structure? The SAS 5 amino salicylic acid join with the sulfa pyrimidine to make sulfasalazine. Similarly, the 5 ASA will bond form azo bond with inert substance which is the 4 amino benzyl to make bala salazine. And similarly, the 5 ASA will form bonds azo bond. Now I am making this bond due to small space, so please uh, focus on my voice. It will bind to another 5 ASA. So these two molecules join by azo bond to form osalazine. So these are the structures of these drugs. Okay, now bacteria will break these bonds, and these 5 amino salicylic acid will able to perform their structures, to perform their physiological action. Now let's move on to the next page, and after that we will discuss further more information about this drug. So here the mechanism of action is explained earlier. So the mechanism of action which I have discussed about the 5 amino salicylic acid, the same mechanism you will write here. So there is no difference. So therefore I have no write it again. So now we'll discuss the pharmacokinetics of it. So it is given orally and has enteric coated tablet. So why it is enteric coated? Because we don't want to absorb this drug in the small intestine. How it is excreted out through the urine, and only 10% of this drug is absorbed. So has very low absorption of it. Now, what are the adverse effects of it? I have said that due in the sulfasalazine, due to the presence of sulfapyrimidine, it has a lot of side effects. Whenever a drug came to have sulfa in it, make sure that it contains various kind of adverse effects. So sulfa group is causing a lot of effects inside your body. So all the drugs who contain a very small amount of sulfa, they are contagious or they are harmful for your health. They will cause side effects to you. Now let's discuss the adverse effects of sulfasalazine. So first is crystalline urea. It will form crystals in urine. Bone marrow depression means to depress the bone marrow. And what is mean by to depress bone marrow? It means it is decreasing the production of red blood cells. It is decreasing the production of platelets. It is decreasing the production of thrombocytes. So all of these kind of cells are going to produce in your bone marrow. So now we have suppressed the bone marrow. All the production of these cells will decreases. As a result, you will get decrease in the neutrophil, and neutrophil are going to cause the inflammation, as well as you will decrease your white blood cells, and your white blood cells will decrease. So therefore, they cannot produce leukotrienes and causing you uh, inflammation. Next is adverse effect is it can cause megaloblastic anemia, in which your red blood cells become abnormal. They have very large size on them. So this adverse effect can happen. Folic acid deficiency can happen to you, because folic acid is also causing inflammation to you. So they will going to inhibit the synthesis of folic acid and causing the deficiency of folic acid in your body. Lastly, adverse effect is oligospermia. What is mean by oligospermia? So it means decrease in the production of sperms. So it is causing more male fertility. Now let's discuss what is the mesosalbines. This is a second classification of our 5 amino salicylic acid drugs. So they are very similar to our azo compounds. They have anti-inflammatory related to salicylates. They are used to treat ulcerative colitis and Crohn's disease. They induce remission and prevent disease flare. This line should be written in every drug which you discuss here. So make sure you have right this drug. Then how it is converted? It is also present in activated form. Convert into the activated form when it reaches the large colon, and it should be entirely coated. And what is the structure? So its structure contain only 5 amino salicylic acid here. The structure This is salicylic acid, benzene ring having a C double bond OH, and here the OH is present, and at the fifth position the amino group is attached. So actually this is the structure of salicylic acid, and on the fifth position we have just attached amino group to make this structure. Now the mechanism of action is just similar which I have told to you in the first of the video, so therefore you just repeat here, and after that you will write the pharmacokinetics. It should be given orally or enteric coated, released through urine, and it is 20% absorbed. It has more absorption than the sulfasalazine. Then we will discuss the advantages. This drug, mesasalmines, has very less adverse effects. So, what are the advantages? So, it is sulfur free. It is sulfur free, so therefore it has more advantages. It is well tolerated, has very less kind of or very less severe side effects. It has less side effects as compared to sulfazyme because sulfazyme contains sulfur group in it, and the sulfur drugs has more side effects, adverse effects, so therefore you should prevent the use of sulfur drugs in your daily routine. So this was all about the today's lecture. I hope that you will like this video. If you like it, then please subscribe, click on the subscribe button, click on the bell icon in order to get the notification of all the video which I uploaded. So thank you so much. Meet you soon in the next lecture. Till up, Allah Hafiz. अपना बहुत सारा ख्याल रखिएगा, दुआ में याद रखिएगा.